Hello, today I wanted to demonstrate a gentle Japanese style acupuncture treatment for upper back and neck tension. So many of us, from driving, carrying items, carrying kids, computer mouse work, being stuck in traffic, we get a lot of neck and shoulder tension, the trapezius, the rhomboids. So here, as I mentioned in other videos, we always want to palpate the point. Sometimes you can actually even see that it's fairly raised through the rhomboid scapula area, and then tension here through the mid back as well. And then, as I've mentioned in other videos as well, the Japanese needle is the thinnest of all the needles available. And as is the standard in the Japanese style, we typically don't go very deep. Sometimes for deep low back pain and sciatica piriformis problems, we may also go deeper as well. Tight feeling in there, yeah?
Yeah.
There too?
Yeah.
Yeah, you can feel a very hard knot there. So again, what's kind of a misconception is that the needles are so thick, and that they penetrate so deep, like an inch or so. You can see these are barely in, but they go in deep enough to decrease inflammation, improve blood circulation, also allowing the muscle fibers to relax as well. So that's a key point for the rhomboids. Very good upper trapezius point here. For those of you looking up the points, where bladder 43 would be the outer points, bladder 13 the inner points. How's that in there?
Tender.
Yeah, this is a great point that actually is a diaphragm point that allows people to take a deeper breath. It's great for relaxing the upper back, but then also relieving tension between the shoulders and allowing a deeper breath to happen as well. Good point for asthma, respiratory restrictions. And then I always check the neck. She did mention neck tension. I usually compare between these two upper trapezius points, bladder 10 and then gallbladder 20. And gallbladder 20 was the point more sensitive. And then the standard treatment will usually let these the patient rest with these needles in for about 20 minutes. I will do some more needles here shortly for the middle and even the low back with some moxa head needling called Kyutoshin, and I've shown that in some other videos, but this gives you a good indication again of the gentle Japanese, the very thin needle with the superficial insertion for neck, rhomboid, upper trapezius, all the upper back tension that we get. So as I mentioned in the first segment, after treating the neck and upper back, continued with some middle back points that were very good for the digestive system, the liver, and also the tension through the mid back. And then I talked about Kyutoshin, which is moxa head needling. This herb I'm going to light here. These protective shields actually protect the skin from getting warm. We want to get the needle warm, and then the needle's a conduit to get the heat into the low back. That's very good for circulation in the low back, relieving low back tension, also nourishing weaker kidneys and adrenals, which is a big concept in acupuncture theory. And then we always mirror some points along the meridian line, the energy line. So bladder 40 and bladder 58, she She also complained of some right knee problem, but bladder 40 and 58 are wonderful points to relieve the back problems, low back particularly, because it's on the same bladder meridian line. So that gives you an indication of what to expect in a full body back and leg treatment. Again, thank you so much for watching. Please like and subscribe.